that question. We have huge healthcare disparities in this country that are disparities related to race, ethnicity, religion, gender, socioeconomic status, and they're very fundamental in the United States because of a number of factors. We have health disparities that come out of food deserts that are in neighborhoods where people don't have access to healthy foods. We have health disparities that relate to people living in neighborhoods that are closer to toxic waste dumps, that have more air pollution, more exposure, and often those are underrepresented minorities that are in those communities. We have disparities because of lack of access to healthcare. We have even some basic things like having your medicines delivered to you every 3 months, as opposed to having to get a refill and having to go to the pharmacy, creates a disparity where people may not be able to get their medicine and then can have bad complications. There are a number of diseases that disproportionately impact Hispanics and Blacks and women. And so worse outcomes include more hospitalizations and greater risk of death in many conditions. There's a fair amount of data that people of color are less likely to get pain medicines. They're less likely to get a cardiovascular workup for their chest pain, and their diagnosis is often delayed or missed, all of which contribute to worse health outcomes.
I also want to say in women, Black women have about a twofold higher rate of preterm birth. And in our area, that is, if you are in North St. Louis, it's about 17%, but if you're in Clayton, it's about 8 to 9%. So that you're talking only about an 8 miles difference with a twofold higher disparity.
To healthcare, we have fundamentally a for-profit healthcare system, right? We don't have Medicaid for all. We don't have the same level of healthcare delivery for everyone. People who have jobs, have health insurance if they work for a company that's big enough to have health insurance. But we have a very unfair system, right, in which people can't access health care if they don't have insurance or they don't have money to pay.
I guess just to add to that, because I have lived outside the United States and it gives me some perspective, that we need as a country to think about healthcare as a right and not a privilege. Because I've lived in Germany, and everyone is presumed to have access to healthcare, including rehabilitation services, mental health, and that's just a given. Like living in that culture, and then coming back here, I can really see the difference in that some societies have decided as a country, we care about everyone. The health of each individual is important to us as a community. And the United States hasn't really thought that way, though the pandemic may be pushing it. Maybe the pandemic is making people finally realize that if your neighbor's sick, it's going to affect you. Like everyone who lives around you needs to have access to healthcare. But again, our system in the United States really understands healthcare as a privilege and not a right. And I think that's something that we really need to dismantle.
When we also improve the structure of healthcare delivery so that the most vulnerable and the most at-risk population benefits, it makes it better for all of us. I get my mammogram every year now because the van is there in the North Campus parking lot and it's super convenient for me. I think it really structuring things so that they work for everyone benefits us all. And I really, maybe it's easier for everyone to join in and being allies if they, kind of reflect on the fact that they stand to benefit as well. in really material ways.
I agree completely. I would love to have, public health care for all and have the equivalent of Medicaid or Medicare for all. I think that would make a huge difference. We do all have the opportunity to vote for Medicaid expansion, so I want to make a plea here for everyone to vote and to get out and to vote for Medicaid expansion. In the states where Medicaid has been expanded, it has actually made a tremendous difference in access to health care and reducing health disparities, but also it's improved the economy, right? And it ends up saving money and being better overall. So we are obviously actively engaged in trying to help people get to the polls to vote or to do mail-in ballots. Because of COVID, people can do mail-in ballots. So I hope we get everybody registered and get people to vote.
So that vote is August 4th. And in collaboration between the medical school and the Brown School, there's a 3-part series around that you can learn a lot about Medicaid expansion and its potential, the models around economic impact for our region, around the health and well-being of children and their families. And so if you go to Clark Fox Policy Institute, you'll see all the details of that 3-part series. So if you want to be educated before your vote and have real science behind, there'll be medical school colleagues, Danforth's faculty, lots of voices from the community around Medicaid expansion is potentially a real benefit to our region.